So what happens when I treat a trigger point? So a trigger point is a taut band in a muscle, and what can happen is that this taut band can refer to other parts of the body away from the area where the muscle has this trigger point. For example, a common one is a trigger point in the upper trapezius. What can happen is that you can get these headaches to the side of the head, to the temple area. Once this muscle relaxes, that headache tends to fade. So when you're on the table, what will happen? What will you feel? So when I'm working on a trigger point, I may take a knuckle, I may take a thumb, my elbow, and press down on this trigger point on this area. And what you'll feel on the table is that you will slowly start noticing a bit of a spike of pain towards the area that you're complaining about. So, for example, the upper trapezius it can refer into the side of the head here. What you may notice is that the headache becomes worse, but this is temporary. So what will happen is that it'll start increasing, and then all of a sudden it'll peak, and then slowly the pain should start fading once that muscle relaxes. So it may take a bit of time before the trigger point relaxes. Sometimes it might take 30 seconds. Sometimes it takes a couple of minutes. Sometimes I have to go back and forth to that particular area to get that muscle to relax. But that's what happens generally when you're on the table getting a trigger point worked on. Have yourself a great day.